That wouldn't see me.
Well, they're sitting in the back of me because I'm
Trying to see the slide.
yeah. So, but if I
Yeah.
stand this way, what do you all
Somebody
see?
probably
Because
didn't
I
know
can't.
That's fine. Then we
Okay.
can see you on Zoom.
Okay.
Yeah, that's all right.
Yeah.
And on Zoom, do you see both? You see the slide and me?
Yes.
Okay.
Yes.
That's what I was coming back for. Oh, yeah, so it's on speaker view.
Okay. Good. All right. Good afternoon, everyone. We are starting a few minutes late. Thank you for joining us. We are working out some really sophisticated technology, and we seem to have been able to accomplish that. My name is Midra Surratt. I'm the Executive Director of Parent Information Center of Delaware, and I'm so pleased that you're here. You're joining us here today and have the opportunity to hear the amazing work that our many grantees funded under the Family Shade, which is the Support Healthcare Alliance Delaware project, that the work that they've done for this particular, the second year of the grant. A little bit about Parent Information Center. We are actually celebrating 40 years this year of supporting families, children with disabilities, their families, and the professionals that serve them. And our mission is to improve health and educational outcomes for children and youth by empowering them, their families, and the professionals who serve them. Our website is www.pickupdel.org. And our support to youth, families, and professionals ranges from prenatal to post high school and adulthood. We have several programs, including a community doula program. We work with families and support families around early intervention. We support children and families in the educational process through K through 12. And again, we support those individuals from post high school and beyond. And we leverage that in a number of ways and provide that support in a number of ways through one-on-one consultations and as well as leveraging community partnerships. And so these are some of the programs and services that are offered through PIC: our Parent Training and Information Center, our Family to Family Health Information Center, which was previously known to many of you as Delaware Family Voices. We also house the Surrogate Parent Program, which provides support to youth in foster care, our Community Doula Program, the Family Shade Project, which you'll hear more about today, our Youth Leadership Program, and most recently, the Delaware Public Education Ombudsperson Program. I mentioned our Parent Training and Information Project, which is mandated under the Individuals with Disabilities Education Act, provides support to parents of children with disabilities and special needs from ages birth to 26. Every state under IDEA is mandated to have a PTI, or Parent Training and Information Center, and PIC serves as the PTI for the state of Delaware. We also are the Family to Family Health Information Center for the state of Delaware, which allows us to provide support to families navigating health and insurance systems, providing peer-to-peer, emotional support, and support for families whose children have behavioral or emotional challenges. And as I mentioned, Family Shade is a project that was set to build state and local capacity through initiatives that support children and youth with special healthcare needs, or SHIN. Many grants to projects are impacting children and youth with special healthcare needs. We funded a number of projects this second year, and you'll hear from them very shortly, some of those projects. Also, which falls under Family Shade, are our Family Leadership Network, which is a group of parents, volunteers, who serve in an advisory capacity to Family Shade and provide information as it relates to supports, community supports and resources, how we can better collectively support children and youth with special healthcare needs. Also under this project, we host a number of learning communities, an annual summit, as well as symposia. And so I will now turn it over to our program consultant, Yvonne Bunch, who will share more information about the mini grant awardees and the mini grant project under Family Shade.
Thank you, Midra. Thank you all for joining us. We are so happy that you were able to join us, the Parent Information Center of Delaware, along with the Division of along with the Division of Public Health. I almost said my other division, the Division of Public Health, in this partnership. I am pleased to announce that we successfully awarded 4 mini grantees. The mini grant awardees are the Children's Beach House, Down Syndrome Association of Delaware, Teach Zen, and Tomorrow's Change. Each of the grantees went through a rigorous award process with a diverse group of reviewers, with the maximum grant award amount of $25,000. A key requirement of the mini grantees include responding to Title IV Maternal, Child, and Health National Performance Measures for children and youth with special healthcare needs. Those measures include Performance Measure 6, Developmental Screening, percentage of children ages 9 through 35 months who receive developmental appropriate services in a well-coordinated early childhood system. Performance Measure 11, Access to Medical Home, percentage of children with and without special healthcare needs, ages 0 through 17 who have a medical home. Performance Measure 12, Transition to Adult Healthcare, percentage of adolescents with and without special healthcare needs, ages 12 through 17 who receive services to prepare for the transition to adult healthcare. And lastly, Performance Measure 15, Adequate Insurance, percent of children ages 0 through 17 who are continuously and adequately insured. At this time, I would like to present the 4 mini grantees. The first mini grantee that you will hear from would be the Children's Beach House. Followed by the Children's Beach House, you will hear from the Down Syndrome Association of Delaware. After the Down Syndrome Association of Delaware, you'll hear from Teach Zen and Tomorrow's Change. At this time, I'm going to turn it over to the Children's Beach House.
Good morning, everyone. My name is Jacqueline Donaldson, and I am the Director of the Youth Development Program at the Children's Beach House. We are very grateful to have been recipients of this award. It was impactful for the children and families that we serve within our programs, and really excited to talk about our outcomes, the work that we did over the course of the mini grant. I'm joined today by a fellow staff member, our nurse Missy, and she'll join us shortly and talk about outcomes as it was directly related to the work of our children in the program. Just to be sure, is it showing up? It's showing up on presenter view, so let me make the corrections here. All right, I think that's better for everyone. All right, so the Children's Beach House, we are a nonprofit that serves children across the state of Delaware. We were founded in 1937, so we've been around for 86 years. Our main facility is located on the bay in Lewis, and we have a program that serves children across the state along with their families, with the mission to provide what all children need across the state. Within our organization, we not only serve children that are school age, we have 3 facets. We have our Children Development Center, which is our preschool program where we work with children 3 and 4 years of age that have special healthcare needs as defined by the system of care. And these are children that have speech and language delays, and they're provided a language-rich environment alongside their typically developing peers. Our program is open to students in the Sussex County area. We also accept purchase of care, which provides the opportunity to some of our under-resourced families. The other leg of the organization is our social enterprise, Greater Goods Events. And Greater Goods, they're a social enterprise that engage with the community and also host events at our facility. And proceeds from those engagements go directly back into the program to serve children and families. And so within our organization, the recipients for the Family Shade mini grant those funds were used for our youth development program. And so what you see here is a picture from some of our participants over this last summer. So the youth development program, again, our target population, those are children between the ages of 7 and 8 across the state of Delaware. And as defined by the system of care standards, these are children that have special health care needs. These are children across the state of Delaware who are receiving speech, hearing, and language services through an individualized education plan in their school. These are also children that typically come from under-resourced home, and we determine that by their ability to qualify for free or reduced lunch in school. So the why as to how we identified this particular group to be our target. Research has shown that children who face challenges that we have identified are less likely to have access to things that all children need: a supportive network of caring adults, a strong sense of self and belonging, and a positive social atmosphere where kids know they're seen and valued for who they are. So when our team started to look at opportunities that were fit for the services that we provide, we were able to identify the Family Shade grant as something that was aligned with our program model, our services, and was really connected to the mission. When we did a review of who the children within our program that would be served under this grant, however, all the children certainly could benefit. We identified that the children that we had served for at least a year and had baseline assessments conducted on them, and we'd be able to measure change over time, would be best suited for this initiative. And so in terms of demographics for the children that were served over the course of this grant period, for race and ethnicity, we served 40% of children who identified as African American, 20% that were identified as Caucasian, 20% who identified as Hispanic, and then another 20 for those that were mixed race. As far as gender was concerned, we had 70% who self-identified as female and another 30 who identified as male. The age range for our participants, we had 5% being 7 to 10. We had 40% those between the ages of 11 and 13, and 55% being the largest percentage. Those are students that were between 14 and 18. In terms of the 3 counties, we saw a division between Sussex and Newcastle County at 45% each, and we served a smaller number of participants in Kent County at 10%. And so when we talk about providing opportunities for children where they could feel valued, creating experiences, and having positive adult role models, during the course of the summer, we explored their local community and provided opportunities where they can see themselves as a part of the larger world. And this was one of the engagements that our program recipients participated in over this summer. And so the approach that we use within our program, it's an evidence-based program model, and it really is strength-based. And we rely on 2 main components of our program: our family engagement coordinators, whose role can be similarly described similar to that of case managers. The family engagement coordinators, they work closely with the child and the family to understand their unique needs and abilities. So using a strength-based approach, They're able to encourage families to leverage their resources in their natural environments, and together they create goals that promote a healthy and gratifying life. And the second facet to program is our camp, which is a residential camp at our Lewis facility, where children are provided a language-rich environment to help to have them recognize their strengths, build confidence, create lifelong friendships in an atmosphere where they feel seen, valued, and appreciated. So our family engagement coordinators, these services really are essential to the establishing medical homes and strengthening families. The family and the children are partners with the family engagement coordinators, so they work together to create goals that are tracked and monitored on an ongoing basis. Each family and child helps to create an individualized plan, which is intended to meet the goals and needs of each child and family. And this is reviewed annually and modified as needed. And then there's also a connection to other community services and partners and establishing medical homes for children. So this weaves together a network of supports that help children and families thrive. Camp, what can be deemed as just fun in the sun for children within our programs, it's really an intentional strength-based programming that helps them to develop their core assets. And those are a strong sense of self and belonging. So it's a chance to learn more about themselves and their place in the world through exposure to new opportunities. And it's also a positive social atmosphere where children and know that they're seen, valued for who they are. Our program, we really focus on the social emotional developmental goals of children that are engaged. And so when we're doing so, we're really working to, address, decision making. So to reduce the risks of risky behaviors and having them learn the skills that they can use into the larger world. Having empathy for others, so not only for themselves, but for peers and community leaders and parents. And children are really encouraged to identify their own strengths, know what their limits are, and appreciate appreciate their strengths and abilities, and really, lead with those. During the course of the summer, we really worked on developing those social emotional goals, and part of that was exposure to new experiences. So in this image, what you see is some of the recipients from this year's grant participating in a new experience, which was therapeutic horseback riding. We found that a lot of children in our program reported feeling a low sense of self, a decreased, not having identified ways to handle stress and stress management. So, however, this was a new experience for many of them that was edifying. And in addition to things like this, we provided opportunities for them to learn about things that they could do at home. One of my personal favorites that some of our kiddos responded and said, one of the best takeaways was when they learned about stress management, and laughing yoga was one that was rated high on the list of things that they were able to take away, something that they could use when they're in school, when they're at home, and really saw the benefits of that. So in addressing some of those risk factors that I think for many of you are seeing within schools, within the community, and with kids coming out of the pandemic, finding creative ways and new ways to show kids that you're not alone in experiencing these things, and these are some ways that you can, manage some of the feelings that you have. And one of the key parts to our success in providing services under this grant was our camp nurse. And Camp Nurse Missy, she was the link for program participants in their medical homes. So our nurse was the liaison between parents and campers regarding their health needs. Our nurse led discussions with staff regarding specific healthcare needs for campers, also provided medication management consults with parents, and was key in leveraging and making recommendations for local providers for our participants that were underinsured or uninsured. So we set out to address these goals that are listed above. We set out that children will have a measurable increase in their sense of belonging, so feeling to be a part of the larger community. Families would have better understanding of their child or youth special health care needs and foster their capabilities. And finally, families will increase communication and information gathering skills and use them to access services and create linkages with other families and facilitate mentoring relationships. Also, we seek to have families increase their knowledge of available resources and services to better meet the needs of their child, youth, and as a family. Our program set out to meet the National Performance Measure 11, which was increase the percentage of children with and without special health care needs who have access to a medical home. And during the course of the service period, we started out with some children who did have access to a primary care provider. However, the engagement might have been low, and or they were not current on their appointments. And there was a low number of contacts with the child's primary care provider. Another interesting fact, we discovered through this process that in the state of Delaware, do not quote me, I could be wrong, but I recall that it was 3.7% of children in the state of Delaware are currently uninsured or underinsured. However, we also found, as we were engaging children and families through this process, that a large number of the children engaged actually were not receiving appropriate dental care as well, in addition to meeting their physiological needs. As we went through the course of the grant period, as we connected more children to medical homes and primary care providers and started having conversations with parents and guardians around their child's unique medical needs, parents reported that they had more favorable conversations with their primary care providers. They felt equipped with proper questions and toolkits to be able to ask the right questions and, not feel intimidated by the conversation. And so with that, there was more positive interaction between our families and their children's medical homes and primary care providers. So as we wrapped up the term, we did identify that some of children within our encampment did have a measurable increased sense of belonging, and this was analyzed and tracked through our assessment tool. Families did reported having a better understanding of their child and their special health care needs. And when I get through talking about the boring stuff, Nurse Missy is actually going to share some of the stories from families as well. Families were able to increase their communication and information gathering, and use that to access services and creating linkages for themselves, and also sharing it with their community and other parents. There was, increased knowledge about resources in the community and services that were tailored to meet the needs of the children and their families. I want to share a story from one of our program participants, and they could do a way better job of talking about the impact of the program and the services. Pardon me.
And I just want to talk a little bit about my experience there. Neighborhood, there was a lot of opportunities and to express myself and to be who I am. So the kid was a safe place because we had people our age that go through the same similar stuff. And at a certain point, that was my only safe place. My neighborhood wasn't safe, but when I went to the camp, I knew 100%. I apologize for the technical. Shayla, I've been going to the camp my entire life. I am 26 now. And I just want to talk a little bit about my experience there. First and foremost, like I lived in a tough and neighborhood. There was a lot of opportunities and to express myself and to be who I am. So the kid was a safe place because we had people our age that go through the same similar stuff. And at a Shayla, I've been going to the camp my entire life. I am 26 now. And I just want to talk a little bit about my experience there. First and foremost, like I lived in a tough and neighborhood. There was a lot of opportunities and to express myself and to be who I am. So the kid was a safe place because we had people our age that go through the same similar stuff. And at a certain point, that was my only safe place. My neighborhood wasn't safe, but when I went to the camp, I knew 100% I was safe. And it was good people at the end of the day. I made connections. I have a 20-year friendship from the camp, and I build relationships straightly from the camp just because at the end of the day, camp is community. They want the best for you. They want you to succeed. And a lot of places not like that anymore. I'm raising a child that goes to the same program I went to. Her name is Danaya. And at this point, she's doing the same thing. She making connection from people her age and people that understand what she's going through. She excited for the next chapter because she becoming a leader because they express. All right, hold on. She was shy at the beginning, but now she out her shell because she had the opportunity she can be. Sometimes parents don't have the a resource to give the child the opportunities, but Kim do. I will go a little bit by backstory. I wasn't a shy kid, but my situation didn't allow me to be myself. But when I was going to camp, I was always loud and proud. I loved it. I thought I was Queen Bee. And now I'm loud and proud too. And I'm a leader. I know who I am. I know why I do certain stuff. And that's a big part for the camp because they gave us opportunity to do speeches or to like dictate games and to like talk to our peers and have no filter. From being a camper to a counselor, I was a counselor there, and I was a great one. I loved it. At the end of the day, counselors should be there for the kid. Don't be there for nothing else. Yes, it's a good place, but be there, generally be there for the kids, because that's what sometimes that's the only place they feel safe. And that's because I was a kid. I knew that, okay, the counselor need to be there for them. And that's what I was. I loved it there. I miss it. I was everything well. I hope going forward that they get back to just having fun there for the kids. And I know with the team that I have now, they're going through that. Yeah. Bye.
So that was one of our program recipients under the Family Shade. And not only did she embody what it is to, participate in a program design that is offered through ours, but as a guardian can also talk to the impact that it's had on her child. And so with that, I'd like to invite our camp nurse, Missy, to talk about some of the testimonials and stories from this summer.
Hi, I'm Missy, and known as Nurse Missy at the beach house. We've got several kids that we've helped get in with doctors or counselor in the community. I have one that had some skin issues and it made her days miserable, and I suggested to mom that she take her to see derm because I thought it was something different, and come to find out it was, but she spent a lot of her days in my office because she was just miserable, scratching, and she liked hanging out at the nurse's office. And the same kid lost her grandfather the beginning of the summer and was having a hard time with that. And I talked to mom, found out what hospice the grandfather was with, and found the program through Delaware Hospice that she could use for her daughter for more support. She really needed it because she really didn't understand, and I do hospice as well. So I was able to help her deal with some of her emotions that she still had about losing her grandfather. Another kid that we had there had issues taking meds, and I spoke with the dad and the doctor, and we figured out a better plan that would help the child benefit from the meds. I think I'm trying to take another one. What was the name?
And I think we certainly saw the need around the dental coverage.
Yeah, we had 3 to 4 kids this year that had dental problems. So the ones that had dentists, I would call the parents and just let them know what happened and recommend they call. You don't see them within the week. And then there were some that didn't have any dental physician in the area. So I would connect them with people in the community for them to see. And then of course I do follow-up calls just to check on the kids to see if there's anything I could help the parents with, because I've been a nurse in that area 20 years. So I've got a lot of resources and know a lot of doctors and some of the specialists. So it's easy for me. And I think we're getting to do a pretty good job of helping the families close the circle for the kids to make sure they get what they need. I was afraid I overtalk because it's my passion.
Kashayla.
And so I think this year we were able to make great strides with the kids that were engaged in the program, connecting them to medical homes, ensuring that they had coverage. And for those that didn't qualify for standard insurance, we utilized a now I'm always gonna revert back to my old home, but I think a Division of Health and Social Services program called HCC, which provides health insurance to those that don't qualify. And so for some of the children that were within our encampment that didn't qualify for standard insurance, we referred them to that program and those providers to assure that they did have a medical home. You know, really, this pushed the envelope to the work that we're already doing with families and opened up the conversation as we're getting back into the schools. We've been talking to administrators about what we saw over the summer and when we were being intentional about meeting these healthcare needs. Some of the stuff that we talked about, the schools were like, oh my goodness, we've seen this happen. And now the conversations are starting to happen of, well, hosting vaccination clinics and things like that to best support some of these kiddos. So I really think that this initiative helped to propel the work that we're already doing and start to address some of these other things that we might not have been putting on the forefront. So our program plans for the future is we're continue to seek out funding to close the gap. I know there are some opportunities that can help to cover the cost of like co-pays and things of that such for children and families, and wanting to start talking about leveraging like preventive conversations for parents so that they too can understand the value. You know, if you prevent something from happening, then you don't have to deal with the crises when it shows up. And for some of our families that are under-resourced, I think that is quite essential. So we were really grateful to have been a part of this program with the Family Shade. And I think just their resource page in itself, we were able to have our parents take advantage of a lot of that with some of those resiliency courses that were up there. So this was a wonderful opportunity and we're so grateful and want to continue to do this great work. Thank you, everyone.
Thank you.
I just want to make sure.
Okay. Hi, everyone. My name is Kima Fulgens, and I am the founder, executive director, and Zen facilitator for Teach Zen, Inc. It is an honor and a privilege to be here today to speak about Teach Zen and what I feel is the just awesome work that I've had the honor to do this past spring and summer. So our mindful mission at Teach Zen is to provide the child care community with the self-care tools needed to handle big emotions so that everyone thrives. So just a little background on why this is so important. Social emotional learning is so important because there's been so much research that shows that our children need to have the ability to have a calm nervous system in order to allow their brains to even learn. You know, I always say, if you were being chased by a bear, would you want someone to be trying to teach you the ABCs? That's literally how some of our children feel inside of their bodies. So the work that we're doing is to give them the tools needed so that they can calm their nervous system in order to even get to the point of learning. So some of our goals with the program, this program is the One Love, One Heart program. This is the first phase of the work that Teach Zen is doing to create childcare communities that is rooted in care and rooted in love. Like, you cannot care for young children without those components. So some of our goals is to go in and work with 3 to 5 year olds directly in their classroom, directly in the spaces that they're in every day, having them join us on the circle, on their carpet for their circle time, and delivering the One Love, One Heart program. So the program gives them the breathing techniques and different things that they can use when they need to regulate their bodies. We the next slide. Oh, okay. So the performance measure that we touched on for this grant is the developmental screening portion. So in working with PIC and Family Shade, which I'm so thankful for having you all to help me during this process, because Teach Zen is a baby, y'all. We've been in existence since January of this year. A baby doing big work. So I was very thankful to have the input of you all to help with getting the information to find out what developmental screening tools programs are using. And one of the wonderful things that happened outside of that is being in the programs, the teachers use the opportunity of having us come in to do their assessments, to put in the data needed to, because now they can pause for a second and have someone doing, these activities that they can, jot down their observations, their assessments, and put those things in. So that was all pretty great. So the One Love, One Heart program is rooted in music, movement, and mindfulness. So we have teaching artists that go out into the field and teach these social emotional learning skills through these components. And I'm gonna pause to take a breath. And I'm gonna share a story. Because I am a storyteller. And so one of the beautiful things about this grant is that it allowed me to service my own zip code, my own community. So I have a story of running into my local grocery store, and I was about a couple aisles over, and I could hear this little girl just wailing, just belting out one of the songs that I would sing when I would come in. And I mean, she was the top of her lungs. And I was like, I know that has to be one of my students. So I ran over, and she was with her family, and she was just going. And I introduced myself to the family, and they were like, what is this song? She sings it all the time. So actually she was singing Fanga Alafia, which is a welcome song, an African welcome song. So I told them what it was, I told them what it meant, and they were very grateful. So now that they can, put some context to what they had been hearing all the time. But it showed, I'm sharing that story because it shows the reach and the span of community within the parents, the teachers, and all things. I'll share some more stories, but we'll keep it moving. So yes, we service the 19805, the zip code, and 19801 for this. And also the programs all received over 50% of their children received purchase of care. And that also was, actually it was 75 to 100%. Some of the programs, 100% were purchase of care. And that information was received during the intake process of the program. Some of the objectives for T-Zen, you can see, I believe that all of you can read. So you can briefly just look through those things. But I do want to add that what these things are not going to show is the amazing community that is formed in going into these programs for the 12 consecutive weeks and having those special moments with children and with educators, because this program is coming in and modeling these activities for the educators, but the educators, they're just so happy for someone to be coming into their room. They want to share their own stories. They want to come and participate. There's so much that goes on that just can't be covered in a presentation. So, some survey, we did survey all of the teachers at the end of the program, and all of them still want us back. Nobody's kicking us out. They're actually really sad to see that the program is ending, but I'm letting them know that a community has been formed. So Tizen is planning some gatherings to get all of the schools, because they're all, childcares all work in their own little silos, right? So having them recognize that there's a larger community, especially a larger community right in their vicinity, you know, that, so giving them the opportunity to come together, but they all want us back. They all want additional social emotional supports in their classroom. So the second phase of Tizen would be to go in and have one-on-one coaching sessions with the educators to assist them with continuing the same things that they saw us do when we came in for those 12 weeks, for them to be continuing those things in their classroom. And there's a voice from the field. Here. Uh-oh. Do I have to share my sound?
I think so.
Okay,
Did you, is the volume up? On there?
Yeah, the volume. It looks like it's up. Oh, I'm unmuted on my computer, or should I?
No, I mean,
Okay.
is your volume up here? Just on your.
I feel like it has put my.
You can, we're gonna stop it here, because they're off. There's nobody on here.
Okay.